The Outer Banks Hospital has once again demonstrated a commitment to a higher standard of care for the community by achieving certification as an acute stroke-ready hospital. This designation for excellence in the care of stroke patients is awarded by the Joint Commission and the American Heart and the American Stroke Associations. While teleneurology services that assist with stroke diagnosis have been available at the hospital since 2014, this certification is a big deal. And here to tell us why is Dr. Matt Chava, an emergency department physician, assistant medical director of Dare County EMS, and the director of the stroke program at Outer Banks Hospital. This is Outer Banks Health. I'm your host, Caitlin White. Dr. Chava, what does Stroke Ready certification actually mean?
So Stroke Ready really designates the Outer Banks Hospital as just being equipped to treat stroke patients with timely evidence-based care before we need to transfer them or admit them to the hospital or to a primary or comprehensive stroke center. We were the first hospital in this region to incorporate a 24/7 neurology program, doing that back in 2014 to help assist with our stroke treatments. And now this is just kind of taking the next step in the diagnosis and treatment of stroke care, just taking it to the next level with this certification.
What was involved in preparing for this certification? Tell us about that.
A lot, actually. So the first thing we did was put together a team to really look at it, and it was a pretty comprehensive team. And myself, we've got our nurses on it, we've got our techs, our radiology department, folks from the quality department, our case managers, folks from the rehab, getting a multidisciplinary team involved to look at the stroke care and all the aspects of it. And then after we did that and kind of, buttoning down on our care, the hospital underwent a pretty rigorous on-site review with the Joint Commission, looking at compliance and specific requirements that they have, things like a dedicated stroke program, staffing by qualified medical professionals, treating stroke care, 24/7 ability to perform diagnostic and lab testing, collaboration with the local EMS agencies, having the availability of telemedicine, the ability to administer the clot-busting medications for eligible patients, as well as a pretty robust community education program, focused really at stroke prevention, because that's a big part of it, and then the timely recognition of stroke as well as the stroke care. And then ongoing, we're constantly doing chart reviews and looking at what we're doing and making sure our care is on point with best practices.
And then putting together all of that to do our presentation to the Joint Commission when they come out and do a site visit. And they look through everything with a fine-tooth comb and try and find anything we're doing wrong. And they did that, and they granted our approval.
So that sounds like a lot of work. Why is this such a big deal for Outer Banks Hospital?
I think it's great for our patients in the community. Again, a lot of the stuff we were doing is we were doing before this, but then being able to put it all together in a package, have a team focused on stroke care. Stroke is a big deal in the United States. I think on average, about every 40 seconds, someone suffers from a stroke. So happening all the time, and just getting ready, for our community and preparing to take care of these folks in line with what the stroke experts are saying is the best way to do things.
Now let's get down to the actual stroke itself. How can people recognize signs of a stroke?
The acronym a lot of people had heard was the FAST. So, if you see any facial droop, blurred speech, arm weakness, that's what people were looking for. And now we actually do a BFAST one, because we want to make sure people know that balance or dizziness, that can be a sign of a stroke as well. So anything, that kind of thick tongue speech is a lot of times how people describe it, or a hard time getting words out. You know what you want to say, but you can't. That's all goes in the speech realm.
And then when should you actually go to a hospital or call EMS?
The moment you start noticing any of these symptoms. So kind of like we say with heart, if you're having a heart attack, time is muscle, get to the hospital right away. Think of it as the same thing. Time is brain. So the sooner you can get to the hospital and we can get treatment started and looking into this, the better outcomes we're going to have. So once you recognize some of these symptoms, or you recognize them in a loved one, calling 911 and getting them out there is the best plan.
Tell us about what is going on in the community now. Should a patient who is having stroke symptoms come to the hospital even during COVID-19?
Yes. So a stroke is still an emergency. So we are still here treating all the emergencies along with the COVID-19. So if someone starts to have symptoms of a stroke, I would recommend they call 911 and get to the hospital. If they're 100% against that, at least you talk to your doctor who knows you, but I think they're going to recommend you come to the hospital as well, because this is absolutely a life-threatening or life-changing disease that we do have treatments for. So come to the hospital early and we can evaluate it.
Dr. Shiva, is there anything else you want to add about either the certification or stroke care in general at Outer Banks Hospital?
Again, recognizing that the team and the effort that everyone's put in for it. I mean, it is a big deal. A lot of people put a lot of time and effort to it, and it just shows, what people are willing to jump up and do. I think the quality of care, the care that you're getting here for your stroke is the same care that you're going to get at any, acute stroke-ready hospital. We are definitely in line with the best practices for treatment and the best practice guidelines and all of that. And the work that folks have done to make that happen is just phenomenal.
Well, thank you so much for your time and for this vital information, Dr. Shiva. That was Dr. Matt Shiva, an emergency department physician, assistant medical director of Dare County EMS, and director of the stroke program at Outer Banks Hospital. If you are experiencing symptoms of a stroke, please call 911. And if you enjoyed this episode, you could find more like it in our podcast library, and be sure to share this episode on all your social channels. This is Outer Banks Health. I'm Caitlin White. Thank you for joining us.